drop. Yeah, very fun this. Yeah.
Hello everyone, welcome to Medic Talks with Health Then More. I am Dr. Rebecca Okolo, and joining us on Medic Talks today will be Dr. VANESSA ATIKPUI. She's a lifestyle and beauty enthusiast, and together we'll be talking about female sexual health. So welcome, Dr. VANESSA. Thank you for taking your time to join us.
Well, thank you for having me. So, hello?
Hello.
Okay, great. I just wanted to be sure. The connection is shaky because you're a bit blurry, so I just wanted to know if you can actually see me clearly.
I can.
Okay, great. Then
Okay, so Dr. VANESSA, can you tell us a bit about you and your educational background in medicine?
Okay, well, a little bit about me, huh? Well, they already know my name. My name is VANESSA, Dr. VANESSA ATIKPUI. I am 25 years, quite young for my whole degree and stuff like that. Well, I studied in China, graduated 3 years ago, and then did my housemanship in Ghana, and I have been practicing since.
Okay.
So yeah, that's just a little summary about me and then my medical background.
Okay, that's really nice. And now about our topic today, which is female sexual health, can you share with us why you think this is an important topic?
Well, it is really an important topic because most people tend to shy away from that topic because they think when someone says female sexual health, a lot of people tend to think about the whole sexual aspect of the topic, forgetting that there is a lot more to it, such as basically the reproductive system of the female and how to take care of it, how to prevent certain illnesses, and then just basically taking care of your female system without having to involve the whole sexual part of it, if you understand what I mean.
Yes, I do. That's really nice. So what ways do you think what can we do to increase the awareness amongst women, especially African women, that shy away from such topics?
Well, basically, something like this is very important because the awareness, using the media as a tool, is a key role in playing with all these kinds of creating awareness for our females, especially those from the African background like us, because we tend to shy away a lot more because we're not as open to talk about it like our Western sisters, you know. So the media, right now in the 21st century, the media is more of a tool, and I think it's better we take and then we grab it and then use it as a means to create a lot of awareness for our sisters. Yeah.
I agree very much with that. The media can be used as a tool to increase the awareness. We have a comment.
Everyone media now, and you know, we need to get and create a lot of awareness, especially with the females.
That's correct. Mom's boy said they shy away for religious and cultural reasons. I agree with that.
That is totally true. Most people tend to just keep whatever it is that is going on with them because they're afraid to go to the hospital or to talk to the next person just because they may be stigmatized or be looked down upon. And then so they tend to just deal with their issues just by themselves. And you never know what that issue is. And discussing it is a very big and important part in treating or management of whatever it is that the problem may be.
Okay. And what do you think are some of these health issues that women face that they are afraid of talking about?
Majority of them, mostly in the tertiary institutes, tend to shy away from the use of contraception. Let us be honest with ourselves. There's a lot of people and then there's a lot of sex going on. So it's important to just create that awareness that even though you are doing it, you have to do it the right way. And also when it comes to termination, and then termination being abortions and stuff, they tend to just shy away from going to the hospital. And in doing so, they just tend to put themselves in more danger and cause themselves greater complications.
I agree with that. So, okay, I have another question. What do you think an average woman can do to improve her sexual health?
Well, basically, the average woman needs to understand her sexuality, being that, okay, I have gotten to this age, and one, I've started menstruating, which means you've gotten into puberty, and then you're more aware of yourself. So you need to understand when it comes to especially menstruation, what to expect, what not to expect, what to know is normal and what is abnormal. And it's important when you get to that sexually active age that you tend to visit the hospital as often as possible, just so you can be given proper consult on contraception and then prevention of some of these various cancers like cervical cancer and stuff like that. So it's just very important.
Dr. Vanessa, you've really shed some light on very important aspects. Like, we have to understand that every woman as she's growing up, I think we should have some more sex education to let them know you're doing this thing, but there's a right way to do it. Like,
exactly. And if there are complications, there are ways in which these complications can be managed without you having to go through it by yourself. There's someone you can actually talk to who would listen without judging or putting you in that term of stigmatization, if I should put it that way.
You're very correct. That's really very important. Now, another question is, as medics, what do you think we can do to make things better for women in this regard?
As medics, in as much as we have the knowledge, we need to share it out, because we can't just keep it in our heads. We need to let the world know and make them feel comfortable. When a lady approaches you, especially a lady who is not married, we know our African mentality. Once you're not married and you're having sex and having issues and stuff, we need to understand that we need to what is the word? We need to just demarcate that cultural and then religious, and then just talk to the person like a sister, give her a shoulder to cry on, listen to her, and then also advise her as a medic on what to do in the best possible way so as to avoid certain grave complications.
That's very, very, I'm really impressed by the wealth of knowledge in this topic, because there are some things I actually did not consider, and now I'm kind of being educated myself. Yes, I totally agree with everything, because you're bringing new light, total new light. Okay, now, I want to tell the audience, if you're watching, if you have any question, please type them in. Dr. Vanessa would love to answer them. And if you have any female friend or sister or relative that you think would benefit from this topic, please tell them to join us on this discussion and send in their questions. We'll be very happy, because I think Dr. Vanessa has a lot of knowledge, and in a new perspective, things we actually consider.
I do get a lot of DMs and a lot of messaging concerning these sorts of issues from so many of the girls, and they present their issues, and you're just thinking, what can I do to possibly help this girl without her having to feel that I am looking down on her, or I am judging her, or making her feel like she needs to stop talking to me or run to someone else. You know, it's very important that we really try to embrace one another and talk to the other. Put yourself in their position and ask yourself, if it was me, what would I do? If it was my sister, what would I advise her to do? You know?
Oh my, like, as a young girl, when I was growing up, I'm very aware that I did not have this resource. Maybe if we had, we have advocacy for cervical screening, but what about the sex education itself? Do we have an organization that tells girls, come to us, talk to us about this topic, we're here to help you? We have for breast cancer, we have other things, but what are the things we have done before that for these young girls that maybe when they're in secondary school, they're already having sex? We can't let them have this safe place where they can go to discuss these issues that will actually let them know when they talk to someone that's been there, like, oh, look, I didn't know this, and I actually went on to have sex without protection, and look at me now, HIV positive. Like, this is your first encounter, you're seeing the person live, you're like, okay, this is real, it's not a joke. Because when you're away from the situation, you might not really think it's real until you see someone that's been there. And then as medics, what you said, we should also do it in a non-judgmental way. Okay, we're still waiting for Thank you so much, Dr. Vanessa. Doodle Beth said, do you think sex dolls are good? Is a good way to reduce sexual diseases?
Well, so long as you're not sharing the sex doll and keeping it clean and stuff, it is a good way to reduce them. That would be my best answer.
All right, that's good. Yusan is saying, good work, girls. Appreciating your contributions to this field. Thank you.
Thank you.
All right, I'm still checking, reading for questions. Please send in your questions or your comments. What do you think about female sexual health worldwide in Africa? What can we do to make things better? All right, Dr. Vanessa, taking you a bit away from the topic, I'm going to ask, what is the best piece of advice you've ever received? And what advice would you give to other medics?
Well, the best piece of advice was from my mom. She always tells me, well, it's not really medically related, but it's an advice that I have learned to use in my daily doings. So she just basically tells me to be happy in all things and to just look at the brighter sides of everything and to know that everything happens for a reason. And at the end of the day, it's not the end of the world should you fall into any trouble.
That's really good.
Yeah.
I'm just typing in.
Okay.
I'm just typing into those watching that. Please type in your questions. That's what makes this session very interesting. Okay. So some questions are coming in. All right. Let me just finish typing in my. All right. So from Usman, how can we talk about sexual health in the general population? Our company is about to do some work with AMA. How can we get the government involved with this health message?
Well, the main thing is to create that awareness. First of all, you have to know who to talk to and who to go to, because you need to involve, yes, you do need the government and the media. So the more awareness you create, the more people would get involved and then know that, okay, this is something that is going on. Yes, I'd like to get onto it. You know, sexual health is something that is now upcoming. There's a lot more people that are embracing and trying to talk about their problems that go on with their sexuality and everything involved in it. So I think it's a great thing that you're trying to do with your government, and use the media as a tool, create that awareness, and then speak to the right people. And it would be taken from there.
I think to add to what you just said, I see the point in Dr. Usman. If we can pay attention, you know, like in medicine, we're told there's primary prevention, secondary prevention. Like this sexual education is primary prevention. If a young girl already knows what to do to use the condom, maybe we could reduce some of those risk factors for the things we're now managing at the end stage. So I think we should have more groups. And if Dr. Vanessa, as you said, if there's a lot of awareness on social media, or the government might actually pay attention, because those some of us don't have this connection to government. So, but if we do enough on social media, maybe someone in government might be like, okay, this is an interesting thing we could actually do. So thank you for your contribution, Usman. Moving on to Femi Superstar. Is it normal for a female to have spottings before and after her periods?
Well, usually spotting before and after periods can either be normal or abnormal. You know, for every woman, every menstrual cycle differs with every woman. The majority usually have a 28-day cycle, and their period lasts for 4 to 7 days. So some women, well, depending, usually you can have some amount, and we need to understand that there may be some irregularities in the menstrual cycle. It's not always going to be exactly on the same day. And sometimes you may have a little bit of spotting before the menses, and also after the menses when you think that you have had your menstruation or that period is over. So what I usually do is advise the girls that even though they feel that this is the last day of my menses, they should still wear a sanitary pad, because you never know, you may just still spot. Also, there may be some other abnormal reasons, such as an infection. So it's always good to know the kind of spot you're having. You need to know the color. You need to know whether it's offensive or not. And when you have these characteristics, it's important to visit the hospital and have it properly examined.
Yes.
So
very good. Yeah, very good, Dr. Vanessa. Thank you. Eddie Edmonds, that answer was too easy. I don't understand. Then from
That was the answer for my, I think for my mom's advice or for the government.
okay, all right, from Miss Anike, creating more awareness is a great way to reduce sexual diseases. Any people, okay, many people are ignorant. True, and I really think the focus should be on women, because if the woman is educated and she knows how important it is, when she has her kids, she tells her kids early.
Yes.
And we should destigmatize the whole sex thing, because the more stigma we attach to it, the more
people
hide from telling the truth about what they are dealing with, and we have more problems at the end of the day.
Yeah.
All right, Doodle Bet, do you think abortion should be allowed for underage girls?
When you say underage, what do you mean? Can you elaborate? Okay, so for my opinion on termination, well, I don't really like to use the term abortion because it's a bit too dramatic, if you know what I mean. So I just tend to use the termination because of that relation you're trying to develop with your client or your patient. So for me, I usually, okay, 14 and below, okay, underage, that's, well, okay, so to answer the question, for my opinion on termination, I feel that if a patient comes to you and has found themselves in a situation, especially considering that they may not be emotionally, financially, or psychologically stable for that baby, you have to advise that person as a medic on what's best to do. So you advise the person. So for me, what I advise is I tell them that this is what we have. We have the medical, and we have the medical termination, and we have the manual removal. Where the medical termination, where you take in some medications, and then the manual one where you are either taken into theater or is done in a clinic where it is your uterus is manually entered and then removed. But also there are procedures to these things, and for abortion or termination is quite tricky and very controversial because there's so many things that need to be put into consideration for whether or not it should be legal or made illegal. I think at the end of the day, it is the choice of the person to decide whether or not they want to go on with the pregnancy. Because at the end of the day, it is her body and she has to decide what is best for her.
Ethics 101. We always present our patients, give them what they want while giving them the message to make the right choice. Yes.
Exactly.
From Miss Anike, early screening too is important. Yes. Yes.
Early screening is very, very important, especially for the sexually active females.
Yes. Now from Dari D, very good question. How do you bring up the issue of sex with your patients? Any tips?
Well, as a medic, you know that there is, when a patient comes into your consulting room, it also depends on what the patient approaches you with. You cannot go talking to a 65-year-old woman who came in with probably burning sensation in her chest. You cannot go talking to her about sex. I mean, that is just completely ridiculous. So first of all, you need to analyze what your patient's problem is. And also, we are taught in school, or we are taught during the clinical aspect of our housemanship, that there's a clerking process where you go from presenting complaint and all those things, and then you go to the OBGYN, or that where you can ask about their sexual history or their social history, all that kinds of stuff. So if the patient is new, and you can just chip it in. So just knowing and analyzing the patient and then just figuring out what it is that they presented to the hospital with.
Yeah, very good point. Age is very important in knowing who to talk to. And just to add to that, Dari, like, I think the focus in this kind of discussion should be young girls. Like if you see a young girl, let's say like 16, 17, coming in with suprapubic pain, you could just try to, like, are you sexually active? Do you use protection? Then you tell her, so there's something they taught us here, you'd be like, I'm going to ask you some questions, and these questions are what we usually ask patients that come in with this kind of
Exactly.
So it's not about so you're indirectly telling her that it's not about you, but this is what we usually ask patients that come in with. So it's a simple sentence. Okay, after asking her, you don't start with sex. You first go through the piece, presenting complaints, analyze, then go with. Okay, let's say her name is Michelle. Like, okay, Michelle, I'm going to ask you some questions now. They are what we ask patients that come in with this type of complaints.
Exactly.
You're sexually active. Then you go on from there. Do you use protection? Do you know about the types? Are you interested in it? Yes.
Engaged.
Yes. And if she's reluctant to tell you any information, you'd be like, I'd like to assure you that whatever we discuss here will be kept confidential and will never be disclosed without your consent, except I am required by law. So all these things are like clinical. It's a sentence because there's doctor-patient confidentiality. Even if your mother comes to meet me to ask about your life, I will never, like a doctor, a medic cannot ever disclose what.
Yeah.
So I think when we assure these young girls and young boys that we are here for best interest, so and trust us more. Tell them it's like, oh, I saw doctor so, and he or she was really nice to me and gave me this advice. I think you should also go there. And I think what they call it, first-hand encounter will really, I don't know how they put it, like your testimonial. So like just like you're giving one-on-one encounters and they are spreading the information. Let's go and see her. She has this, and then maybe you go to the clinic too, a sex clinic, and the information going on. So it's a simple line. If you want to reach me for that line, it's something they just taught us in OSCE. Just give them that line. All right. What are the guidelines for safe sex practice from Miss Anike?
Well, for safe sex practices, I wouldn't say exactly that there are specific guidelines, but in order to have safe sex, you need to be sure that you and your partner are well protected. You're free from all diseases. So you need to go check, especially when you're considering having unprotected sex, meaning no condom involved. You have to both get tested, ideally get tested, and then you can take it up from there.
Very good. So I think that's the ABC. Abstinence.
Exactly.
Use
Careful.
condom.
Use condom. Yeah.
So I think those are the guidelines. Very simple. ABC.
ABCs. Just be careful, and then if you abstain, if you can't, just be careful, and then use condoms always. But if you want to condoms, please get tested.
Very good. Yes, get tested. Now from Maltiti to Dr. Vanessa, fine doctor. Okay, from Eddie Edmonds. At 14, I suggest they seek counseling, and I'm hoping they come with an adult. What do you think about that, Dr. Vanessa?
Well, that's a very controversial topic because you need to understand whether or not the patient was abused, because once they go below that consensual age, it becomes abuse. So you have to talk to the patient and consult them, make them comfortable to know that, yes, I would need a guardian or a parent to come with you where we would discuss this issue, because now it becomes a law thing, you know. It becomes a court issue. You have to, it's a whole complicated issue with that, especially with children.
I have
who are that
about this particular question at 14. In the Western world, we know the practice is different. They don't stigmatize underage children. The only thing I think who is your partner?
Yes, is older than you, way older than you, because they do the teenage. It's 14 and 15, that is consensual sex. 15 and 17 is consensual sex. But once you cross that 18-year-old line, that becomes a legal issue.
Yeah, so Eddie Edmonds, for the last part when you said, I'm hoping they come with an adult, that part is definitely...
They don't always with an adult, because majority of them are probably having sex, and they're not supposed to, with probably someone who's way older than them. So they usually tend to come in without the company of an adult. So that's when you're put in a situation where, okay, what do I do? So at that point, you just have to make that child very comfortable to know that they can trust you in order to confide in you and then tell you who this person is that they're with. And also after you have gained that level or amount of trust, you tell them, seek their permission to invite another person, which is a relative or a guardian, to be present with them.
And I think that depends on the country you're practicing in.
Exactly.
Because
you're sending them straight to their house.
Yeah. Because let's say you're practicing in Canada and a 14-year-old comes to you looking for abortion, you don't have to. You only have to ask about who the partner is, which is not really compulsory. Then, if the patient insists on the termination, you give it. You don't have to. They don't have to come with an adult. You do it.
Yeah.
What is the law? So it depends on where you're practicing. All right. Let's see if we have any more. Yes, Dr. Andrew Ugo. Abortion laws, however, vary in different countries. As ethics is concerned, the legality of it is very important. Thank you, Dr. Andrew. That's all we're talking about. It depends on where you're practicing. Yes, okay. Yes, Dr. Okay, Huseman.o. How about men's sexual health? I think it's equally as important. Are you going to have a session on this also?
It's important, and I'm sure there will be plans and adequate preparations for that.
Okay, Dr. Usman, we'll talk to Dr. Vanessa. We hope we'll be able to get her again to do that with us. I think it's also important. Okay, from Dare D1, most patients are conservative and would never bring up the issue if you don't ask. I find even men are shy when it comes to sexual. My question really is, are there any tips to make your patients more comfortable?
Yes, of course. You just have to talk to them like you're talking to a sister, you're talking to a friend. Because sometimes some of them come in with white coat fever. They see you in your doctor's coat with your stats around your neck, with your straight face, and you're just like, they're just not sure how to approach you with a topic. You'd be amazed how much you would get from a patient if you relax and make them very comfortable. So first of all, you just ask them to kindly sit and then let them know that whatever it is that you're going to discuss in that room remains between the two of you, unless of course they intend to have someone with them. At that point, you would have at least gained a level of trust. Then you engage them in a conversation, asking them, so what brings you to the hospital? Is there anything particular that you are here for? You know, and then once you have gained that rapport with the patient, they will just tell you everything that's on their mind, whatever it is that is bothering them. And then you as a medic would be able to counsel them to the best of your knowledge.
Thank you.
So the key is the patient very comfortable.
Okay. Yeah. Dr. Dari, I hope that answers your question. Okay. From Edmonds. Sexual education should start from home and must be at an early age. I prescribe celibacy until marriage. Dr. Vanessa.
In as much as we prescribe celibacy until marriage, we still cannot shy away from the fact that there are people who are still having sex before marriage. So we need to deal with what are the complications to these things, and then sort out the issues, because you are not going to force them to not have sex until marriage, and you cannot make them feel stigmatized or be judgmental that they will not come to you, and then you would end up with probably a ruptured ectopic on your table and you'll be wondering what at all is this. But you forget that you as a medic failed to educate them and make them feel comfortable enough to come to you at that early age where it could, that complication would have been prevented. So yeah, celibacy is important, but in as much as we want to preach that, there are people who are having sex, and we need to deal with that also.
Yes, I totally. Okay. Mimi A. We are lacking on planned pregnancy posting, and some professionals are very judgmental, which makes it difficult for young people to access services.
Exactly. So that is exactly what we have been talking about since the beginning of this show. No judgment. It's a judgment-free zone where you should be able to talk to one another. I think we still have a long way to go in our African setting, because majority of these people, luckily, there are a lot more young doctors who tend to listen and understand the patient, as opposed to back in the day where it was some elderly woman sitting there who, even before you get into her consulting room, you're already scared, and you probably would do a U-turn before your name is called because you don't want to be stigmatized and shamed for what you have done. You know, we need to make these girls feel very comfortable and know that we're not there to judge them and make them feel bad about what they've done. In as much as what may be wrong, there is a solution, a good solution and a proper way to handle certain things, as opposed to them rather just going somewhere and taking some concussion and coming around with complications. I mean, what would you rather have? An early diagnosed ectopic or a ruptured one?
Yes, I agree. Yes. Well, we should make them feel comfortable. Okay, Dr. Vanessa, we talked about this question, but I think this is different now. Ms. Anika is asking, what are the guidelines for safe sex practices for sexually active women? Like, the woman is already sexually active, so what can she do? How can she have sex safely?
Yeah, so even though you still have to, what's it called, wrap it up, make sure you're getting your immunizations, have your pap smears as often as possible. Go see a gynecologist. If you change sexual partners, you need to, and there are any complications, maybe you are having pain while you're having sex, there's any spotting, or there's any discharges after that, or a few days after, you need to go see a gynecologist and then be properly diagnosed, and then if there's a medication or there's a treatment to be given, you are treated with that. So yes, you're having the sex and you just have to be safe about it. Try using a condom. If not, just always just always have a gynecologist you're comfortable with to talk to, should in case there's any issues.
Thank you so much. Thank you for that. Have a gynae. From Eddie Edmonds, in the Western world, 3 years over is statutory rape if the female is under 17. Okay, thank you, Eddie.
There's that, yeah. Thank you, Eddie.
I, Mimi A. Some people might come with an adult and it will amaze you. The adult is the one abusing them. So in the UK, this to young people is quite confidential.
Yes. So even usually what you do is, even in our African settings, I don't know about the other hospitals, but for my hospital where I work at, when a client comes in with the adult, we usually, and we sense that there may be some sexual abuse here, we ask them if they're comfortable with the person who came with them to be in there. And if they say no, you are obliged as a medic to ask the person to kindly leave. You know, so yeah, it's important that you just develop that rapport, like I always say, make the person comfortable. Or if the person is refusing to leave while you're examining the patient, you can just talk to her, because that is a female to female thing.
Okay, thank you. Yusman is asking, are there any free sexual health medication or facilities available to the public paid for by AMA, municipalities or parliaments? How do we make the public more aware? That's 2 questions.
So basically, yes, there are. In every hospital, or in majority of the hospitals, there are public health units where all these counseling and sexual health is discussed. And you are given, most of the contraception is free or at a very, very reduced cost. And also there's a lot of awareness that is created in that unit. The only problem is most people are not aware that there are parts of the hospital that do these things. So to answer the second question, which I answered previously, is to create the awareness that there are things like that put in place in case you need that kind of counseling.
Okay, thank you very much. From medical student fashion, truth is that most people aren't celibate. I think young people that come should just be taught how to be safe instead of being preached at. Exactly. Sending them away to their friends or worse, the internet.
Exactly, that's true. Because when you tend to preach to them, tell them, oh, you know, you shouldn't have done that. It was very bad of you. Now look at what you've gotten yourself into. Trust me, when that girl leaves your consulting room, she is not coming back. And that is not what she wants. She would probably go talk to her friend who would give her one advice or another. I'll tell you an experience I had. There was this patient that presented to my consulting room. Well, there are no names mentioned here, so yes, I can discuss it. Presented to my consulting room. She had some vaginal discharge a while back, and someone advised her to use garlic in her intimate area. And she had first-degree burns, and that's what she presented to the hospital with. You know, so these are the sorts of things that we see in our consulting room, which makes us ask ourselves the question, what is it we're doing wrong? Is it that we're not talking to these people? Is it that they're not hearing us? Is our approach wrong? Is our approach making them feel like we don't want to listen? Is our approach making them feel like we're being judgmental? You know, so we just have to talk to them, because they do listen to their friends, listen to the radio, and there are so many herbalists and stuff going around saying that you can drink a bottle of this and then everything would be cured. I mean, that is just ridiculous.
I have a question, Dr. Vanessa. Speaking about the garlic, there's this popular herb in Nigeria. It's called Kaya Mata, Guru Matai, and they tend to put them in their private parts, and it will make them, you know, wet, thick, and all sorts of things. And I'm wondering, like, if we had a sex clinic, I think those clinics will be telling the women the right things to do. Like, what is the relationship between putting Kaya Mata and Gula Matari? I don't know, because I've not really seen these things first. But what do you think?
Well, I see those things, and sometimes it makes my heart cringe, because I'm thinking, these people, what I must give to them is they create a lot of noise. You know, I must give that to them. They really do create a lot of noise, and in as much as you don't want to listen, you are drawn to it to listen and find out, oh, what is this about? And someone sitting somewhere without any knowledge will think, I've been having this issue. I've been seeing this discharge and stuff like that. Let me just try this. Forgetting that there's some discharges that are normal, you know, and some that are not. There are some that are not normal. So you need to understand the difference between the normal and abnormal vaginal discharges before you can even think of inserting anything in there. You know?
And Dr. Vanessa, from what you're telling me, I think there are some women that maybe they are perimenopausal and their vagina is dry, and what they need is maybe some topical estrogen. And instead of them to see their doctor, they trust Kaya Mata to help them.
Exactly. You know,
and these things definitely they're going to upset the balance of the vagina and because they are not medically tested. We don't really know. We don't give what we've not tested without proof.
Exactly.
So I think, and maybe for the young girls that want it, probably they're not getting enough foreplay and they don't get enough stimulation. So they think which can be used solved with a loop, but instead they opt for Gayam Matari.
Of course, because they're shy to go to the hospital and then seek care or seek probably the attention that they need. And most people, like I was saying, because of the judgmental nature of some people, or some people think that they would be judged, they tend to just rather sit behind their phones or their order these things online and have it secludedly delivered to their houses. But what we are trying to say is you don't have to do that if you're having an issue. You need to be comfortable enough to go to the hospital, and that's what falls on us medics, to create that environment where a young girl would be comfortable enough to come see us and talk to us about her issues.
Yes. Okay. At this point, let me say shout out to 2 Nigerian sex educators. That's Ask Dr. Malik and Wumi Omololu. They are really doing great in terms like the medical doctors that talk about these issues. But I think if we can let others know that medical doctors treat these issues, you don't have to see like they see it as it has to be Goya Machari. Like they don't see going to a real medical doctor to say, oh doctor, I'm having issues with sex. They think it's not a medical problem, it's a herbal problem.
Exactly.
So I think if we need to create awareness that we are here for such issues to help you when
Yeah.
you're having issues with.
Exactly.
Okay. From Eddie Edmonds, Dr. Vanessa, is it ethical to continue treating your ex?
Wow. Well, I think when we're taught in ethics class, we're not allowed to treat people that we've had relations with. So to the best of my knowledge, I think it's not advisable to continue to treat your ex. Yes, I mean, there's nothing wrong with forwarding her information to another GP to take over because of the relations you have with the person or have had in the past with the person. So yeah, whether it's ethical or not, to the best of my knowledge, to me, it isn't.
Okay. Now from Vivek 31, are there any side effects of too much sexual practice?
When they say too much sexual practice, what do they mean?
Maybe having a lot of sex regularly.
Well, you will lose a lot of weight.
Okay. All right. So, Vivek, that's your answer. You will lose a lot of weight, but I don't think of much else. Dr. Vanessa, you are very beautiful. Yes, you are, Dr. Vanessa. Okay, from Cherry FA, this garlic thing, surprisingly, so many girls do it.
Exactly, because they forget that everybody is different, you know. There are some people, yes, it may have worked for, you know, and also the technique in which it would have been done, because you see on the internet that you can grind some garlic and just put it, you know. After she presented to my clinic with that issue, I actually went online because she told me her friend told her about it, and it was also online. So I actually decided to go online to check it out for myself, and it was actually online that, yeah, you can use garlic in that area, but the issue is you don't have to put, it's not everything that you insert in that area, you know. Garlic is very, I mean, garlic, I don't know, it's just as bad as onions. You can literally get burnt, and that area is a mucosal area and it's very, very soft and tender, so any slight thing and then you're getting burnt.
Yes, true. Very true. At It's Yee, Dr. Vanessa, what do you think of creating a sexual health blog to regularly update the public and corporates on these issues?
Well, it's actually something I have been working on, and occasionally I do things like these to educate women on their sexual health, the pros, cons, abnormal, and then what's normal. So yes, it's in the pipeline.
Okay. From IBA, Dr. Vanessa, are you open for collaborations, and is your passion in women's sexual health?
Well, yes, my passion is a lot in women's sexual health. I'm actually looking at starting my residency in obstetrics and gynecology this year. So yes, it is. So yeah, any collaboration, so long as it's to the benefit of women and creating awareness and empowering women and stuff, yes, I'm open to it.
Okay. From Cherry FA, why can't you treat your ex? You didn't give any reasons.
Because I did give a reason. I said because you've had relations with the person.
Okay. All right, Dr. Beck. I'm just going to read your comment anyway. Dr. Vanessa, are you single? You are so cute.
Oh, Vivek, thank you. However, I'm not single.
Okay.
I'm very...
All right. Thank you so much, Dr. Vanessa. We've come to the end of Medic Talks. Do you have to? Can you give us some final words, like to conclude the discussion?
Well, I would thank you so much for having me on here. It's actually been an honor, and yeah, I would say that for every female that tuned into this, and for every guy that did too, it's important to create awareness. Let us stop the stigma and the judgmental sides of seeing a patient, especially when they come to us with issues concerning their sexual health, because it bothers them and then they're looking for help and they need the right answers, and who best to give it to them than a medic? So it's not good to be judgmental. Let's just advise them like we would our sister, we would our friend, we would our partner, or we would ourselves. you know. So basically, that's just it.
Thank you very much, Dr. Vanessa. It was a real pleasure having you here. Thank you so much. And to all those that joined us today, we appreciate your presence. Thank you for your comments and your questions. Till next time, don't forget, always be brave enough to start a conversation that matters. Take care of yourself. Bye, Dr. Vanessa.